Good evening, everyone. Today, I, Shailesh Gangwar, is here to present my presentation on a portion of a topic named extended release dosage of drug. I will be covering two parts.
Good morning. I, Shagun, will be explaining extended release of drug dosage. Extended release medications are slowly released into the body over a period of time, usually 12 or 24 hours. They are typically available in an oral tablet or an oral capsule. They differ from immediate release medications, which release content within minutes of ingestion. Basically, extended release formulation enable the dosing interval to be increased, which maintains concentration within the targeted range while decreasing the fluctuation in peak to trough concentration. The decreased fluctuation may result in reduced toxicity and also fewer concentration related AE compared with IR formulation. SDC should be restored by giving any point within the next dosing interval or by giving an additional ER dose together with the dose. Extended release drug doses typically have slower release rates, which can result in fewer concentration-related AEs and can prevent side effects that may occur during the absorption phase with IR formulation. Lower peak concentration may allow some patients to have their local daily dosage increase without experiencing AEs, resulting in improved seizure control for the same chemical moiety when an ER formulation is used. ER products have the potential to improve adherence by reducing local AEs such as gastrointestinal intolerance that can be associated with IR formulation. Additionally, ER formulations that are enteric coated may improve gastrointestinal tolerability in some patients. Use of AED-ER formulations is generally associated with better adherence and seizure control than IR formulations. Several studies in adults have shown that an increase in adherence was associated with a decrease in the cost of care and hospitalization. The graphical representation. In this, the x-axis shows the time and the y-axis shows serum AET concentration, in which the immediate release and delayed release have both the same peaks and extended release slope is decreased. Basically, the systematic diagrams of changes in blood serum drug concentration over time for different drug delivery systems. For the immediate release formulation, almost immediately following ingestion, the SDC rises and quickly peaks before rapidly falling off. For the delayed release formulation, the SDC profile is similar to the IR formulation, but there is a lag phase following ingestion before the drug is released. For the extended release formulation, the SDC rises more slowly from the time of ingestion, forming a much broader concentration curve over time. Simulated SDC time curve are steady state for IR administered 3 times a day and ER administered once daily. AET formulation during a 2-day period, repeated doses of IR formulation are required to maintain SDC within the therapeutic zone for optimal seizure control. This can result in wide peak to trough fluctuation in concentration. From some patients, seizure control with IR formulation may require drug doses that results in a peak concentration that is above the therapeutic zone shortly by the administration. This decreases the likelihood of concentration-related toxicity. The SDC drops shortly before the next IR dose may be below the therapeutic zone. Extended release formulation can allow for reduction in dose frequency, which may enhance convenience and thereby improve adherence. The aim of ER formulation is to minimize fluctuations in SDC between doses. Although a flat serum concentration may not necessarily improve efficacy, it can simplify AED therapy and can minimize concentration-related AE. Phenytoin was approved by US Food and Drug Administration for the treatment of epilepsy in 1953, but it was not until 1976 the Pfizer New York became the first oral ER formulation and EAT available in the United States. 2 decades later, the next ER formulation with the carbazine as the active drug arrived. Since are more than 10 ER products for treating epilepsy. Although ER formulations of AET are widely available, IR products are more frequently prescribed worldwide. This popularity may be largely driven by lower concentration cost and order of introduction to the market because IR formulation are typically introduced first. समझ नहीं आ रहा हैंग क्यों हो गया लैपटॉप भी हैंग होने लगा तो बहुत मूवी तो कितने दिन का गया देख ही नहीं रहा हे भगवान मेरे साथ ये सब क्यों कैसे कैसे तो काम करें और वो की तरह नहीं दे सकते थे क्या रिकॉर्ड करो ये भेजो वो भेजो बताओ कहाँ से हम करें लैपटॉप ही नहीं चल रहा बताओ बताओ नहीं तो ना और डांट पड़ेगी
First is type of extended release drug delivery system, and second is advantages of extended release drug delivery. So, first topic is types of extended release drug delivery system. Uh, there are currently three common types of extended release drug delivery system. First is matrix drug delivery system. Second is reservoir drug delivery system, also known as a membrane controlled drug delivery system. And third is osmotic release drug delivery system. So the first part is matrix drug delivery system. A drug embedded in a polymer matrix is released from the matrix by the process of erosion or diffusion. In hydrophilic matrix system, water enters the matrix which begins to swell. The dissolved drug is released by diffusion out of the matrix and by erosion of the matrix itself. So as you can see in the picture, the first one, erosion one, is basically an example of hydrophilic matrix system. Here the drug is present inside this polymer matrix, and as the water comes, the membrane swells and is eroded, releasing the drug. Second is hydrophobic matrix system. There is minimal swelling of the matrix, but a swollen gel layer forms on the surface matrix. As the water enters the matrix, the drug dissolves and is predominantly released by the diffusion out of the matrix through the surface gel layer. As you can see here, the diffusion, the swelling is less as the water enters, but by diffusion, the drug exits this layer and is diffused in our body. Here we are taking an example of ADE, that is anti-epileptic drugs. Next is reservoir drug delivery system, also known as membrane controlled drug delivery system. This system typically contain many subunits, be it beads or pellets containing the drug. Upon contact with water, the insoluble membrane becomes porous. The Here two methods through which we can intake the drug. First is swallowed intact. The capsule is swallowed intact. As the water enters the system, water soluble drug is released from the subunits and diffuses out through the pores in the membrane. The timing and rate of the release of the drug can be modified by including a mixture of subunits with different drug releasing characteristics, that is immediate release, delayed release, or extended release in a single capsule, together with changing the thickness of the insoluble membrane and size of the membrane pores. Next is sprinkled one. As an alternative to swallowing the capsule, it can be opened by the user and the subunits can be sprinkled onto a spoon of soft food. The mixture of food and drug is swallowed without chewing or crushing. The next is osmotic release drug delivery system. These system consist of the drug and an osmotic agent surrounded by semi-permeable membrane capsule containing a small orifice. As you can see, here is the semi-permeable membrane capsule that is made up of semi-permeable membrane and a delivery orifice. So first one is single chamber one. In single chamber capsules, water is drawn into the capsule by osmotic agent, which begins to swell, forcing the drug to the orifice. As you can see, through the osmotic agent, the water enters and it pushes the drug outside through the delivery orifice. And the second is double chamber capsules have an additional push chamber containing a highly swellable polymer. Uh, as the water enters, this area swells, indirectly pushing the drugs out through the delivery orifice. As this polymer swells, the push chamber expands, exerting pressure on the drug containing chamber, forcing the drug through the orifice. Now, advantages of extended release formulation reduces the frequency of dosing. Whenever you ask a patient to take a medication numerous times per day, you're increasing the likelihood of non-adherence. Adherence is basically when a doctor asks you to take medicines at a given time. That is adherence to the prescription. When immediate release is used, multiple doses per day are often required. But with extended release versions, we can usually get down to once a day. Second is decreased fluctuations in peak and troughs of SDC. SDC is serum drug concentration. Less frequent local and systemic adverse events. Extended release drug delivery system typically have slower release rates, which can release in fewer concentration related adverse events and can prevent side effects that may occur during the absorption phase of IR formulations. Lower peak concentration may allow some patients to have the total daily dose increased without experiencing adverse events. Overall decrease in healthcare costs. An increase in adherence was associated with high increase in the cost of care and hospitalization. As you can see, if a person follows his regime regularly, medication regime regularly, uh, he will get cured and will decrease the chances of him or her being hospitalized, decreasing the overall cost. Hence, ER formulation has the potential to reduce overall healthcare costs uh, as compared to uh, other formulations.
So, hello guys, this is Ankit Kumar Shah and I am going to tell you about disadvantages of extended release dosage forms. So, let's just start. The major disadvantage of the extended release dosage form is high cost as it has a higher manufacturing cost than other dosage forms. Another major disadvantage of extended release dosage forms is that side effects can remain much longer than an immediate release short acting product. Failure of the technique may result in the risk of the sudden and total release of the drug. It is not useful whenever partial doses are needed because they need to be taken intact, not divided into parts. Splitting or divided into parts can cause its release property to be lost. The combination of multiple drugs can experience or ingredients complicates it to formulate. Extended release formulation may cause a slower onset of action. Not all drugs are compatible with the formulation of extended release dosage forms. The release rate can change by various factors such as food and fasting. The release rate can vary from one dose to another dose. Let's move to the next slide. Clinical application and practical consideration. Administration. Different ER formulation have a specific instruction for administration. The main factor to consider are whether the tablet should be administered with or without food and whether the tablet should be swallowed whole and not crushed or whether it can be opened and the contents sprinkled onto the soft food. Ghost tablets. A feature of some DDS product is the phenomenon of ghost tablets. Example, Tegristal XR. This occurs when the shell that houses the drugs does not disintegrate or become digested but passes out intact in the stool. This can be a source of anxiety for patients and caretakers if they are not pre-informed that this is part of the normal functioning of the DDS and does not affect efficacy or indicate any absorption problem. It should be noted that all osmotic release DDS leave a ghost tablets. However, the same is not true of matrix or reservoir DDS because the drug is released via diffusion and some leaves a ghost tablets whereas other do not. Next, move to the storage. According to the individual labeling requirements, most formulations should be protected from moisture. Unlike most IR formulation, moisture can destroy the releasing characteristic of VR formulation. Hence, storage in bathroom cabinets is strongly discouraged. Stored at 25 degrees Celsius with exclusion permitted to 15 degrees Celsius to 30 degrees Celsius. And third one is protected from light. Storage conditions should be in accordance with USP guidance on control room temperature. For further details on the storage of individual formulation, the reader should consult the prescribing information. Thank you.
So I would like to summarize my two topics. First is types of extended release drug delivery system. See, every type has its advantage and some disadvantages. So according to the need of the patient, we have to use different types of methods of implementing the extended drug delivery system. Also, the advantages are more as compared to the disadvantages, which will be covered by Saket in the upcoming slides. Thank you. Thank you.